Welcome to It Started Somewhere, the podcast that uncovers the history behind the familiar. I'm your host, Shaimond, and today we're diving into the history of antibiotics, those miracle drugs that have saved countless lives and revolutionized modern medicine. Imagine a world where a simple cut could lead to a life-threatening infection, where pneumonia was a death sentence, and where surgeries were incredibly risky due to the constant threat of infection. This was the reality for most of human history before the advent of antibiotics. In the early 20th century, infectious diseases were the leading cause of death worldwide. The average life expectancy in industrialized nations was a mere 47 years. Diseases like smallpox, cholera, diphtheria, pneumonia, typhoid fever, plague, tuberculosis, and syphilis ran rampant, claiming millions of lives each year. But humans have long known that certain substances could fight infections, even if they didn't understand why. Ancient civilizations, including the Egyptians, Nubians, Chinese, Serbians, Greeks, and Romans, used moldy bread as a topical treatment for infected wounds. While they couldn't have known it at the time, they were unknowingly harnessing the power of antibiotic-producing molds. The modern era of antibiotics began in the early 20th century thanks to the work of several pioneering scientists. Our story starts with Paul Ehrlich, a German physician and scientist who laid the groundwork for antibiotic research in the late 1880s. Ehrlich was fascinated by the idea of a magic bullet, a compound that could selectively target and destroy disease-causing microbes without harming the human body. Ehrlich's work with dyes that stain bacteria led him to experiment with various chemical compounds. In 1910, after testing hundreds of substances, he made a breakthrough. Ehrlich discovered salvarsan, an arsenic-based compound that effectively treated syphilis. This became the first synthetic antibiotic used in medicine, marking the beginning of modern antibiotic chemotherapy. Fast forward to 1928, when Scottish bacteriologist Alexander Fleming made one of the most famous accidental discoveries in the history of science. Fleming was working in his lab at St. Mary's Hospital in London when he noticed something peculiar on one of the Petri dishes. Fleming had been growing Staphylococcus bacteria, but he observed that mold contaminated one of the dishes. Surprisingly, the area around the mold was clear of bacteria. Intrigued, Fleming isolated the mold and identified it as belonging to the genus Penicillin. He named the antibacterial substance produced by the mold Penicillin and published his findings. However, Fleming struggled to isolate the active compound and produce it in significant quantities. As a result, penicillin remained little more than a laboratory curiosity for over a decade. The true potential of penicillin wasn't realized until the late 1930s, when a team of scientists at Oxford University, led by Howard Florey and Ernst Chain, began working on Fleming's discovery. They managed to purify penicillin and demonstrate its effectiveness in treating bacterial infections in mice. The timing of this breakthrough couldn't have been more crucial. As World War II raged on, there was an urgent need for effective treatments for infected wounds. The U.S. and British governments threw their support behind penicillin production, turning it into one of the first examples of successful collaboration between academia, government, and industry. By 1945, penicillin was being mass-produced and became widely available to the public. Its impact was immediate and profound. Infections that were once fatal became easily treatable, and the drug was hailed as a miracle cure in the press. The success of penicillin sparked a global search for new antibiotics. Scientists began scouring soil samples from around the world. looking for microorganisms that could produce antibacterial compounds. One of the key figures in this antibiotic gold rush was Shaimond Waxman, a soil microbiologist at Rutgers University. Waxman and his team focused on a group of soil bacteria called actinomycetes, which turned out to be a treasure trove of antibiotic compounds. In 1943, Waxman and his graduate student Albert Schatz isolated streptomycin from a strain of Streptomycin grius. Streptomycin proved to be the first effective treatment for tuberculosis, a disease that had plagued humanity for millennia. The period from the early 1940s to the mid-1960s is often referred to as the Golden Age of Antibiotics. During this time, researchers discovered and developed a wide range of new antibiotic classes, including tetracyclines, chloramphenicol, macrolides, glycopeptides, rifamycin, and quinolones. Many of these antibiotic classes are still in use today, forming the backbone of our defense against bacterial infections. After the initial boom of antibiotic discovery, the pace of development began to slow. By the 1970s, many pharmaceutical companies shifted their focus away from antibiotic research. There were several reasons for this. The low-hanging fruit had been picked. Most of the easily discoverable antibiotics had already been found. Developing new antibiotics became increasingly expensive and time-consuming. The profit potential for antibiotics was limited compared to drugs for chronic conditions, as antibiotics are typically used for short periods. This shift led to what's known as the discovery void, a period from 1987 to 2000, when no new classes of antibiotics were introduced to the market. As antibiotics became more widely used, a new challenge emerged: antibiotic resistance. Bacteria, through natural selection, began developing mechanisms to survive antibiotic treatment. The overuse and misuse of antibiotics in both human medicine and agriculture have accelerated this process. Today, antibiotic-resistant superbugs pose a significant threat to global health, capable of turning once treatable infections into life-threatening ordeals. Despite these challenges, the story of antibiotics is far from over. Researchers are exploring new approaches to antibiotic discovery and development, including mining the human microbiome for new antibiotic compounds, using artificial intelligence to predict and design new antibiotics, reviving abandoned antibiotic candidates with new technologies, developing alternatives to traditional antibiotics such as bacteriophage therapy. The history of antibiotics is a testament to human ingenuity and the power of scientific discovery. From the moldy bread poultices of ancient civilization to the cutting-edge research of today, our battle against harmful bacteria continues to evolve. As we face the challenge of antibiotic resistance, it's crucial to remember the lessons of the past. The development of antibiotics was not the work of lone geniuses, but the result of collaboration between scientists, governments, and industry. It's the kind of collective effort that will be needed to address the challenges of the future and ensure that these life-saving drugs remain effective for generations to come. And there you have it, folks, the incredible journey of antibiotics from accidental discovery to medical revolution. It's a reminder that some of the most important discoveries in history started somewhere, often unexpectedly. Who knows what world-changing breakthroughs might be hiding in plain sight today? I'm Shaimond, and this is It Started Somewhere. Remember, stay curious and keep exploring. I'll catch you on the next episode.